Hello, my name is Dr. Tyler Shiflett, and together with Dr. Ramsha, we created the study and the poster Developing Resident On-Call Guidelines for Contacting Off-Site Attendings in a Hospital System. At the University of Arizona Psychiatry Residency Program, a significant portion of the educational experience during the second and third year includes managing responsibilities on night call. There are no attendings on the premises overnight, but they are contactable by phone. Policies regarding when to call the attending were sparse, but originally included decisions related to patient disposition, admit or discharge from the emergency department, transfer acceptance from outside hospitals, and the like. However, given the on-call responsibilities also include management of patients on one of 3 psychiatric wards in the hospital, a survey was written to gauge residents' comfortability and concerns related to calling attendings. Given the lack of clear guidelines regarding when to contact off-site attendings, there was as much variability in how and why residents called attendings for patient concerns as there was variability amongst the residents themselves. Adding to the variability between residents and their comfort levels were the attendings as well. Given there are no overnight attendings, those that answer the residents' calls are a large group of constantly rotating daytime attendings who all have their own level of comfort with specific residents. In practice, this led to increased concern amongst the residents related to the inherent ambiguity of which patient concerns rose to the level of staffing with an attending. To diminish these concerns, in conjunction with residents, attendings on call, and the medical director, a list of must-call attending items were brainstormed, made into a survey, and distributed to the residents.
Thank you for that, Dr. Shiflett. Hello, everyone. My name is Dr. Ramsha, and I will be presenting some sections of this poster. So for our objectives, we wanted to develop a guideline for residents for seeking further supervision on call shifts. Furthermore, we wanted to gauge the efficacy of this guideline. For our methods, general resident perceptions on contacting attending was assessed using a pre-survey in February 2020, which led to the development of the must-call attending list. This list was implemented into policy. It was circulated among the residents and posted in the call room. In March 2021, a post-survey was conducted to evaluate the effectiveness of these guidelines and to assess the need for further adjustments if they were needed. Moving on to results. So 72.7% of the residents responded to the survey. In this pie chart, we can see the breakdown of our respondents by the year of training. Now at the University of Arizona Tucson program, call shifts are primarily done by PGY1s through PGY3s, and PGY4s are excluded from the calls. If we see the pie chart and if we exclude the PGY4s, we see that our response rate from the residents actually doing these call shifts is around 85%. When asked if the residents found these guidelines helpful, 79% of them responded yes, that they did find these guidelines helpful. When asked if they felt more comfortable contacting their attending while on call, about 85% of them responded yes, that they did feel more comfortable contacting their attending while on call using these guidelines. When asked if they believe that these guidelines improve patient care, 78% of them responded yes, that they did believe that these guidelines improve patient care. When asked if residents felt that their call experience was more educational using these guidelines, 59% of them responded yes, that it was in fact more educational using the guidelines that were provided.
Last year, after concerns were raised related to the variable nature of when to call an off-site attending, possible additions to the must-call attending list were brainstormed. After the residents chose which items were appropriate to add to the list, institutional change was implemented that made the more expansive list into policy. 1 year later, the follow-up survey indicated that not only were the additions to the must-call attending list helpful overall, but they were also specifically beneficial in increasing residents' comforts on night call. Critiques of the must-call list are likely to point out that part of resident training is becoming more independent with decision-making. Thus, it will continue to be important to find the balance between burdensome regulations and residents having and feeling supported on night call. In concert with this, studies related to and future iterations of the must-call attending list may prove beneficial in relation to pruning of the list. Thank you for your participation.